In this video, we're going to show you how to introduce egg to your baby. Okay, so it's very similar to the way we do nuts. In fact, it's exactly the same. There is no tricks around here. We just follow the guidelines and they're actually very simple. So what we're going to do is you're going to scramble the egg. So the egg should be really well scrambled. So some people don't like it like this, but this is how it should be when you are introducing it to baby. So it should be kind of not runny and not sloppy. Okay, so almost a little bit hardened and plasticky. Okay, so you can do that on the hob or on the microwave, whichever way you want. At this point, when you're introducing it, I wouldn't add any fancy bits to it. Some people, like me, like a bit of milk and butter and salt and pepper in their egg. But at this point, when you're introducing it, just keep it plain egg. We don't need to be introducing extra things as well. But it's personal choice. So what we would do is we'll start with 1/8 of a teaspoon. So we'll start with a small amount of egg. This is absolutely fine. And we're going to give that straight in the baby's mouth. We're not going to rub it on the skin. We're not going to put it anywhere else. We're just going to straight in the mouth. It's the only way we're going to know whether there's going to be an allergic reaction or not. We're going to have our cheat sheet, our allergic reaction cheat sheet with us, and our allergy food tracker, so we can write down what we're giving. And we're going to give 1/8 of a teaspoon, and then we're going to wait 20 to 30 minutes until the next dose. So the next dose is going to be 1/4 of a teaspoon. So we're going to give a little bit more. So we're going to give 1/4 of a teaspoon after that 20 to 30 minute gap. 20 minutes is fine. And then we get it again straight in the baby's mouth. Okay. After the 1/4 of a teaspoon, we're going to go for 1/2 teaspoon. All right. So 1/2 teaspoon straight in their mouth. And then we're going to wait 20 to 30 minutes. And then we're going to give them a whole teaspoon. There we go. So there is a whole teaspoon there. That's probably a little bit more than a whole teaspoon. All right. If you wanted to stop at 1/2 teaspoon, that's okay. All right. That's okay for day one. The important thing is that you've started to introduce it, and that's the main thing. Okay. So once we've introduced it, then we've got a cheat sheet for you, which tells you how to keep these things in the diet, which, just so you remember, is around about twice a week, every week. Okay. At least until they're 2 or 3 years old, ideally. And that's why you should only really introduce things to your baby that you are going to eat on a regular basis. All right. So that's egg. I hope you've enjoyed this. You can refer back to this video anytime you want, or you can contact us with questions.